Well, the U.S. now has more coronavirus infections this year than all of 2020, believe it or not. This comes as the White House is set to announce a plan for tackling the next phase of the pandemic.
Meanwhile, the World Health Organization is taking a hard look at a new COVID-19 variant. News 6's Amanda Castro joins us now live in studio. And Amanda, what are doctors saying about this new variant? Are they concerned?
Well, Ginger, right now they're just keeping a close eye on it, saying that Delta is still the dominant strain in the United States, and that should be our focus. But of course, the concern is as the virus continues to spread and mutate, will our vaccines and treatments still be effective against variants?
Variants are being tracked across the globe.
And last week, the World Health Organization designated the Mu variant as a variant of interest, saying more studies need to be done to confirm whether it could evade existing antibodies. It was first documented in Colombia back in January.
There is the concern always with each emerging variant that this will be the one that evades our treatments, evades our vaccine, causes more severe disease.
Dr. Kelly Tice with Florida Blue says it's too early to tell if that will happen with the Mu variant. But she says the bigger concern is still Delta, which is the dominating strain in the United States.
While there's a lot of conversation about this Mu variant, the Delta values are so high that it tends to outcompete the new variant, at least for now.
Dr. Michael Tang is a virologist and professor with USF Health. He adds the Mu variant is the dominating strain in Colombia, but it doesn't appear to be quickly spreading outside of South America. And while there are cases in the United States, he doesn't think it'll hold up against Delta.
Frankly, I think Delta has got such a transmission advantage that it's going to be difficult for Mu to take hold.
He cautions COVID will continue to mutate and develop variants as long as it continues spreading, saying it's going to take a worldwide effort to bring an end to the pandemic.
This is a global problem. We need to get everybody vaccinated. That means the people in South America where the Mu is, or from Africa where Beta came from. This is a global pandemic. We need global solutions.
And of course, the concern is, will Mu evade our current vaccine? Well, Dr. Tang says one of the mutations it has in the spike protein is also found in the beta and gamma variants. And there is a decrease in effectiveness with those strains, but he says Mu won't be any worse.
Amanda, thank you.